Hello friends. Today we are discussing about the 5 moments of hand hygiene. This is very common now in the healthcare setting, and to all the nursing applicants this question is very important. One question will be there in the NORSET or other nursing exams regarding the 5 moments of hand hygiene. So, what are the 5 moments of hand hygiene? There are 5 moments of hand hygiene. First is before touching the patient. Second is before clean aseptic procedure. Third is after body fluid exposure risk. Fourth is after touching a patient. And in the last, fifth is after touching patient surrounding. So we all are very familiar with these 5 moments of hand hygiene. But the question is, when the examiner asks in the question, they will give 4 options. Either one will be incorrect. So we read very carefully these 5 hand hygiene. So just like first is before touching the patient. So if you are going to touch the patient, we don't know what kind of patient is. The patient may be very risky. The patient may be having some contaminated disease. So, and we also are ourselves uh, contaminated. Our hand is also contaminated. So before touching the patient, we have to hand wash properly. So before touching the patient. Second is before clean or aseptic procedure. If you are doing any type of clean or aseptic procedure, then you need to also hand washing properly. Like any kind of aseptic procedure or clean procedure if you are doing, then you have to perform hand washing. Third is after body fluid exposure. Now yourselves are contaminated here because you are exposed with the patient's body fluid like blood, any kind of the body fluids you expose, so you need to be wash your hand. So third point is after body fluid exposure. Fourth point is after touching the patient. Now you already touched the patient, so you have to be wash your hand because we don't know what kind of the disease patient are suffering. Patient may be some contaminated disease, patient may be some blood infectious disease. So we have to perform hand washing after touching the patient also. The fourth point is after touching patient. First was before touching a patient, and fourth is after touching a patient. Fifth is after touching patient surrounding. When I was given the exam, there was one point also in the options that before touching patient surrounding. So that option was incorrect, before touching the patient surroundings. So these things you have to keep in your mind. There will not be before touching patient surrounding, it is after touching patient surrounding. So the thing is before and after, we have to know where it is before and where it is after. Like before touching the patient, after touching the patient, before clean aseptic procedure, after body exposure, and after touching patient surrounding. So these are the 5 moments of hand hygiene. Thank you.